they get the crowd into it, then the defense, starts playing above their head, and then it becomes a really difficult game.
Baltimore Gameday Uncensored pregame show. Let's take a look at the injury report.
Injury Report is brought to you by Orthopedic Associates of Central Maryland. In pain? Contact the experts at Orthopedic Associates of Central Maryland at mdbonedocs.com. Care this good feels good to the bone. Injury Report.
And we're joined now by Dr. Scott Adams. And Dr. Adams, as always, thank you so much for your time. I know this is not your area of expertise, but it sounds like a non-COVID virus went through the Ravens building this week, and a few of them were sick, and Lamar got better and now sick again. And I guess he's super dehydrated, and that's why he can't go today?
Sure. I mean, one, this is a major problem in team sports. You take your whole team and you put them in the same locker room, or you put them in the same meeting rooms, and this is the scenario that scares all of us in sports medicine, is that you take one, not a serious illness, but something that is contagious, like the flu or a cold or some upper respiratory tract issue, and you put all of your team and all of your best players in the same room, and it just takes one person to then spread it to the next. You look at the type of players that, at least on the injury report, were listed: your quarterback, your center, and a wide receiver, who are obviously all going to have a vested interest in being around each other and working together. And so you first have this perfect storm of a contagious illness that then is in a contained environment. Once it has spread, then it's an issue of, are they dehydrated? What is their energy level? How is their concentration? If it's some sort of like sinus infection, is it causing headaches? Is it causing blurry vision? There are all types of things that can go into this, and it can easily affect your ability to perform your best.
It's kind of funny about that, Doc, because you hear like so many, great games happen when a guy was sick, or, the flu game, or Michael Jordan, or, all these type of things. So I'm guessing that, loading them up on ibuprofen and, loading them up on IVs, I guess that's not going to get it done.
Well, I think that's what you try. I mean, first you look at their overall clinical health. I mean, if they have a fever, then you probably can't play. If their vital signs have anything out of the ordinary, you have concern. But if they are stable from a health standpoint, but they just feel kind of crummy or yucky, then you start trying those strategies. Do you do the ibuprofen? Do you do the IV? And you see which of those can play and which of those respond better than others. And so it is not a lost cause that anyone that's affected can't play. You see who responds better to some of those supportive measures, and then you can decide whether they're safe to go.
Doc, Brandon Williams still out with the shoulder issue. Your best guess, what do you think is keeping him out?
Yeah, when you think of the types of injuries that a player like he might get, would be something like a low-grade AC separation. If he fell wrong on the turf, he could just have a low-grade AC separation. He could have had some sort of shoulder subluxation that didn't actually tear any of the structures. And then it's not uncommon to get just really bad bone bruises, especially around where the rotator cuff inserts. And so it's not a terrible injury like a rotator cuff tear would be, but it can cause pain and it can affect his strength and his ability to perform. So the fact that he can't go says it's something that's painful enough to prevent him from performing, or something that could get worse. Luckily, I think most of the possible scenarios are something that shouldn't be too long-term a problem.
Hey, Doc, what about with Marquise Brown? I mean, it says thigh. Anytime with Marquise, especially a guy that relies so much on speed and quickness, any thigh or hammy, I mean, to me, that is a tough one for him.
Yeah, that is a tough one. I mean, more than likely it probably is some sort of hamstring strain. And for his position, yeah, that definitely can affect his ability to play. And it also is one of those injuries that if he's not completely recovered, he's at risk of re-injuring. So this is one where it will be interesting to see how long he is affected by this, which is going to be dependent on just how severe a strain it was. But he definitely needs to get over this if he wants to get back to his same explosiveness and lower the risk of it happening again.
Dr. Scott Adams, as always, thank you so much for your time. Enjoy the game.
Great. Thank you, guys.
Baltimore Game Day Uncensored pregame show. Ken Wyman, Vinny Serrato live here at the Green Turtle in Aberdeen. When we come back, we will climb the depth chart. Man, oh man, there's some depth chart climbing going on today. We'll go behind enemy lines, and we'll get our first look at the weather with meteorologist Vinny Serrato. It's Baltimore Game Day Uncensored pregame show live here at the Green Turtle in Aberdeen, and we're with you till 1 here on 105.7 The Fan.
Do you have nagging pains keeping you from the things you value most? Playing sports, exercise, or simply daily activities? Then you need to call the specialists at Orthopedic Associates of Central Maryland today. The team of highly trained physicians is there to help. They've been bringing relief to athletes, weekend warriors, and everyday people in pain for over 45 years. Orthopedic Associates of Central Maryland has recently become a member of the Centers for Advanced Orthopedics, the largest musculoskeletal practice in the region. This promises continued personalized care and greater access to all orthopedic services. At Orthopedic Associates of Central Maryland, you can enjoy the convenience of on-site physical therapy and rehabilitation. Visit Orthopedic Associates of Central Maryland today at mdbonedocs.com to set up a comprehensive consultation at one of their 3 easy-to-get-to locations. That's mdbonedocs.com. Return to being able to do what you love doing most, pain-free. Remember, at Orthopedic Associates of Central Maryland, care this good feels good to the bone.
Molly's Ultimate Waterfowl Giveaway is here. Its value is over $10,000 with gear